All right, everyone. Welcome to the Recover Initiative CPR training. Somebody start us off. Why do we need to do CPR?
To get the heart beating again, allowing oxygenated blood to get to the vital organs when the heart and lungs can't.
Perfect. Now, ABCs. That stands for airway, breathing, and circulation.
A little confusing because in sales, ABC means always be closing. We found ourselves on the less prepared side of things when Stanley's dog when his heart went berserk. And I knew exactly what to do, but in a much more real sense, I had no idea what to do. So I thought we could all use a CPR training class.
Okay, so for a small dog or a cat, we'll be putting our patient in lateral recumbency, and we'll be compressing between our thumb and our fingers. Make sure that you let the chest recoil between your compressions. We'll be performing the cardiac pump theory, which is where we compress directly over the heart in order to push blood out of the ventricles. So for a medium-sized dog, again, we'll have them in lateral recumbency, but we'll be using the palms of our hands to compress the chest. For this, we'll be doing the thoracic pump theory, which is where we compress the widest part of the thorax in order to change the intrathoracic pressure. We'll be using this on medium dogs, large dogs, and obese smaller patients. For large dogs, we'll have our patient on the ground, legs away from us, fingers interlocking, elbows locked, shoulders right above the area we're compressing, just like that. Do you want to try next?
Absolutely, I would not. You know who I really think should go? Stanley.
Oh, I don't know.
That's not a good idea, Michael.
Come on!
He needs his rest.
No rest for the sick. We are not going to be there to coddle your dog's heart when it disappears to be working. What are you going to do if you're alone with him and his heart stops?
He would die.
And you're okay with that?
I'm okay with the logic of it.
No. Get up, let's go.
Yes, he had a heart attack. I would quit my job to stay at home with him, but I'm too old to find another one, and I don't make enough money to retire.
Come on, Stanley, you're losing him. Do it.
Michael!
This is your dog we're talking about.
Michael!
All right, I'll take over. Come on. You okay, Stanley?
Okay, so assess the situation. Are they breathing?
No, Rose, they are not breathing. And they have no legs.
No, that's not part of it.
Where are they? I mean, if we come across a dog with no legs, do we even bother resuscitating? I mean, what kind of quality of life is that?
I would want to live with no legs.
How about no arms? No arms and legs is basically how you exist right now, Kevin. You don't do anything.
All right, that's enough. Let's get back to it because you're losing him, and somebody needs to be monitoring. During CPR, we should have somebody feeling for a pulse on our patient during compressions to make sure their blood is being adequately pumped out of the heart. This same person, if we have an ECG or capnograph available, should be checking those in between compressions, but we shouldn't be stopping for more than about 5 seconds. We should also be keeping an eye on mucous membrane color and capillary refill time, because these will give us a good indication of tissue perfusion, blood pressure, and will potentially let us know if we've returned to spontaneous circulation. Okay, that's too fast. Everyone, we need to be pumping at a rate of 100 beats per minute for a medium dog like this. We'll be pumping at 80 beats per minute for a large dog and about 120 for a small dog. Okay, well, a good trick is to pump to the tune of Staying Alive by the Bee Gees. Do you know that song?
I do, yes. I love that song. At first I was afraid, I was petrified.
No, it's staying alive, staying alive.
Okay, I got that. Staying alive, staying alive. Staying alive, staying alive.
You can tell by the way I use my walk, I'm woman's man. No time to talk. Music loud, women more. They kicked her asses, day I was born. It's alright, it's okay. You can look the other way.
Okay. So nobody was monitoring our patient, you stopped your compressions, nobody was ventilating every 5 seconds, and nobody called the vet, so she didn't come. So you lost him.
Can we shock him?
No, we can't shock him. When can we defibrillate a patient?
Ventricular fibrillation and ventricular tachycardia, but he's an asystole.
Exactly.
Dad, anybody know what we do next? Anybody? Rose?
I have no idea.
Anyone else? We bury him? Wrong. Call the owner, check if he's an organ donor. If he is, we only have minutes to harvest.
He has no owner, I checked.
He is an organ donor.
He is?
Yes.
All right, someone give me some ice and styrofoam bucket. Let's go.
Oh my God, Dwight!
We need to harvest the organs. Where's the heart? The precious heart.
What are you doing?
I don't feel so good. I need to sit down.
Hey, Stanley! Stanley, are you okay?
Oh my God!
Oh my God!
Oh my God, Dwight!
Oh my god!
Can you tell me why you had to cut the face off of the dummy?
I didn't think it was very realistic in the movie, but it turns out it's pretty realistic.
We had to pay for it. It cost us $13,500.
$15,300 for a dummy? Wow.
Okay, well, look, David, this is why we have the training. We start with the dummy and we learn from our mistakes. And now Dwight knows not to cut the face off of a real animal.
Even if they did manage by some miracle to save that animal, complications can include cerebral edema, pulmonary edema, abnormal blood clotting, and kidney damage. The longer that we take to resuscitate a patient, the less likely they are to survive. CPR lasting longer than 15 minutes isn't very likely to have a good outcome. Even if a patient manages to survive CPR that lasts longer than 12 minutes, they're likely to have very severe neurological deficits. Less than 10% of patients who receive CPR actually survive long enough to make it out of the hospital.